As you or a loved one prepares to start treatment, this video will help you understand what chemotherapy and immunotherapy are, how they work, what to expect during treatment, and how to manage common side effects. It is natural to feel overwhelmed with many questions and concerns during this time. This video provides a helpful resource you can return to whenever you need guidance. But know your Riverside Cancer Care Network team is always here to support you, answering any specific questions that address your unique concerns. Your personalized cancer treatment plan may include chemotherapy, oral chemotherapy, immunotherapy, or a combination of these treatment options. Let's begin by understanding what these treatment types are and how they work to fight cancer in your body. Chemotherapy is a type of treatment that uses medicine to kill cancer cells. Immunotherapy is therapy in which drugs are used to stimulate the body's immune system to treat cancer. Targeted therapy is a type of treatment that uses drugs or other substances to target specific molecules that cancer cells need to survive and spread. Hormone therapy is a type of treatment that slows or stops the growth of cancer that uses hormones to grow. Your medical oncologist will provide a personalized care plan where treatments and therapies are selected specifically for what is best to treat your cancer. Your plan is individualized based on extensive research and factors unique to you, to include your specific type of cancer, the stage and characteristics of your cancer, your overall health, and other medical conditions. Your plan also follows evidence-based treatment guidelines developed by the National Comprehensive Cancer Network, or NCCN. Throughout your treatment, you'll have an entire team of healthcare professionals dedicated to your care, from your oncologist who oversees your treatment plan to the nurses who administer your medications. You're surrounded by experts committed to your well-being. We understand that everyone's situation is different. Some of you have family and friends ready to help, while others may be navigating this path more independently. Whatever your circumstances, please know that your cancer care team becomes a kind of extended family during this time. Professionals dedicated to supporting you every step of the way. Chemotherapy and immunotherapy work in cycles, periods of treatment followed by periods of rest. This rhythm allows the medications to destroy cancer cells while giving your healthy cells time to recover. On treatment days, you'll have your vital signs taken. Expect to be weighed at each visit. This is done to help assess your nutritional status and to safely calculate medications that are dosed based on weight. This is also a good time to talk to your care team about how you are feeling and share any problems you may be experiencing. Throughout your treatment, you will have visits with your medical oncology team to monitor your body's response to the medications and determine if you are ready to safely receive your next dose. Your blood cell counts will be monitored through lab work throughout treatment to help manage side effects. If your lab work results indicate that it may not be safe to treat you at this time, your medical oncology team may adjust your treatment schedule and/or medications. Once you have been cleared for treatment that day, you will have a short wait as your medication is being prepared by the pharmacy team. You may receive pre-medications to help prevent side effects before your treatment begins. Your treatment can be administered through an IV into your vein, a Mediport, injection, as pills you take at home, or occasionally by other methods depending on your treatment plan. Your medical oncology team will decide the best and safest route to receive treatment. For your first treatment, we recommend having someone drive you home afterward. Wear comfortable, layered clothing, and consider bringing a water bottle, light snacks, and something to help pass the time. Let's talk about some common side effects and how to manage them. Not everyone experiences side effects, even with the same medication. You might have some, few, or even no side effects at all. Each person's body responds differently. Digestive issues like nausea, vomiting, or diarrhea are possible. Stick to bland foods like bananas, rice, applesauce, and toast if experiencing any of these symptoms. Eating small amounts frequently can also help settle your stomach. To help prevent nausea and vomiting, your medical oncology team will guide you in what to do based on your treatment plan and health history. Your medical oncology care team may have prescribed medications for nausea and vomiting that you will need to pick up at a pharmacy before you begin treatment. Your care team will help you with making sure you have the medications you will need. If you have diarrhea, medications like Imodium AD may provide relief. If you are still having diarrhea after taking Imodium AD as directed, please call your medical oncology team, who may send in a prescription for you. For constipation, staying hydrated and using over-the-counter stool softeners can help. Fatigue is one of the most common side effects. Maintaining a healthy diet, adequate hydration, managing stress, and resting can help combat fatigue. If you develop a fever of 100.5 degrees or higher, call your medical oncology team right away. For lower fevers, you can take acetaminophen or ibuprofen as directed. You may experience skin changes, including dryness, rashes, or sensitivity. Using lukewarm water when bathing, applying moisturizer, and protecting your skin from the sun can help. Be sure to report rashes to your care team. If you develop mouth sores, a simple baking soda or saltwater rinse can provide relief. Let your care team know if you develop any sores in your mouth, as this may make eating or drinking difficult. If you notice any white patches in your mouth, please call your medical oncology team. You might experience bone and muscle aches, typically lasting a few days after treatment. For certain treatments, your medical oncology care team may recommend taking a certain over-the-counter medication to help with this discomfort. Knowing when to contact your medical oncology care team is essential. Remember, we want you to call. You're never bothering us. Please call your medical oncology care team if you experience a fever of 100.5 degrees or greater as measured by a thermometer, shaking, chills, burning with urination or productive cough, vomiting that does not stop with the medication you have been prescribed, any blood in your urine or stool, or vomiting of blood, diarrhea that does not respond to medication and last more than 24 hours, mouth sores that are keeping you from being able to eat or drink, and/or unrelieved shortness of breath or cough. If you experience chest pain, severe shortness of breath, bleeding that does not stop, sudden severe headache, sudden changes in vision or balance changes, call 911 right away. Before beginning treatment, it's a good idea to save important phone numbers in your contacts, your clinic's number, the after-hours emergency contact, and the name of your medical oncologist. It's important to care for yourself throughout your cancer journey. Your immune system may be weakened during treatment, making infection prevention essential. Wash your hands frequently with warm water and soap for at least 20 seconds. Try to avoid people with known infections. Your medical oncology team can advise you when you should take extra precautions, such as wearing a mask. Stay well hydrated by drinking at least 64 ounces of water or other clear, non-alcoholic liquids each day, especially around treatment days. Most people can remain sexually active during treatment, but check with your medical oncology care team first. Condom use is generally recommended for everyone's safety. For women in childbearing years, talk with your medical oncologist about options for preserving fertility prior to beginning treatment. You should use contraception and condoms to prevent pregnancy during treatment and for a period of time after treatment is completed, as the medications you have taken may cause birth defects. These medications can also be passed through breast milk. Now is a good time to consider advanced care planning through an advanced directive. This ensures your wishes are known and identifies who would make medical decisions for you if needed. Your cancer care team can provide guidance on these documents. Cancer treatment affects not just your body, but your emotions and spirit as well. It's completely natural to experience anxiety, moments of grief, frustration with new limitations, or worry about the future. Emotions often come in waves. These emotions aren't signs of weakness. They're natural responses to a challenging situation. Music, meditation, prayer, spending time with the loved ones, and doing things you enjoy can help you throughout your treatment. Please know that your team at the Riverside Cancer Care Network is here for you with expert guidance, helpful resources, and unwavering support throughout your cancer journey.